Welcome to Inside Health, where we aim to provide you with expert support on the health issues that affect all of us, and also give you some practical tips and advice to take away too. Today's topic is something that I think affects all of us at some point in our lives, and that is sleep. So whether you're juggling work and family, dealing with an illness, coping with stress, going through menopause, adjusting after retirement, or have a newborn, there are things always getting in our way during life that can impact on our ability to get a good night's quality sleep. In fact, in a recent Bupa customer survey, over 90% said that they don't get good quality sleep, and only 2% said they get more than 8 hours a night. So we know that it really is a big issue. Let me give you a flavour of what's coming up today. First, I'll be joined by Amy Gallagher, who's a senior sleep physiologist at the Cromwell Hospital. And we'll be starting off by chatting about why sleep is so important. Amy will then give us some top tips on good sleep behaviours and what we can all do to reset our bedtime habits to help get us into a good sleep routine. I'll then be joined by Professor Jason Ellis for a fascinating conversation on understanding sleep more deeply and getting the answers that we all really need to know. And finally, we'll be answering some of your questions that have been submitted ahead of today's show. So lots to fit in. So Amy, really great to have you here today to unpack this key topic. You and I speak to people about their sleep all of the time. It's really common that people have issues, and it can be so debilitating when people are not sleeping, whether that is a one-off period of a sleep issue or a sort of longer standing sleep condition. So let's start by, I think, digging into why is sleep so important. What types of things are happening when we're asleep?
So there's actually quite a lot of changes that occur during our body while we're sleeping. So it's a total body experience, and it's an active process. So starting from the head, we have, obviously, when our eyes closed, we start to progress through different stages of sleep. And as this starts to happen, our body experiences changes in our heart rate, in our respiratory rate, and also in our muscle as well. So our muscle relaxes throughout the body. We then have sort of changes in our hormonal regulation as well. So sleep is responsible for regulating certain hormones, and these are all associated then with things like immunity, cell regeneration, muscle repair. And then we also have our memory consolidation. So our memory consolidation occurs as a result of changes in our brainwave activity. Okay. So it's very important.
So many things going on, and what's really fascinating is different phases of sleep or different stages of sleep. There are different things that happen, aren't there? So it's important to try and get through all of those stages. Are there any physical consequences of prolonged poor sleep? I mean, does it put us at higher risk of certain types of conditions?
So unfortunately, yes. So sleep is closely related to a lot of chronic disorders and diseases as well. So we experience sort of changes in our weight and also changes in blood pressure. It's associated with worsening of things like diabetes. It's linked to cancer and also to changes in our mental health. And also things like our skin is impacted, mood is impacted also. So yeah, it's got quite a large effect on the body.
And what about our mental health then? So how does poor sleep impact on our mental health?
So it can cause a lot of disruption. So poor sleep is linked to mood changes, and then that reduced focus and concentration throughout the day. And over time that can then result in sort of anxiousness or anxiety sort of increasing, and that risk of insomnia then also increases as our anxiety risk increases.
Like a vicious cycle.
It's a vicious cycle, and then with a lack of sleep and that increased anxiety and changes to our life as a result, we can start to experience depression also. Yeah, so it is quite a key point of our mental health.
And we talk about having a good night's sleep. Most people would say that is as simple as getting 8 hours, but is it a bit more complex than that?
It is more complex than that, but a good rule of thumb is to aim for 7 to 9 hours. So where 8 hours sleep is ideal, it's not necessarily possible in today's society. So
well, we know from our survey that only 2% of people were getting 8 hours or more.
And it doesn't surprise me. It is unfortunately something that we really need to focus on and put more attention to, and be aware of our sleep patterns and our and how we respond to sleep.
And then obviously menopause, with what happens in hormones there, we know that that's very detrimental to sleep. And what about older adults as we sort of go beyond retirement?
So the menopause is a huge change that women experience, and I think we're going to speak about that slightly later as well, and the changes we can experience in that. But for the general population, both male, female, we experience a change in our sleep needs. So we actually have a reduced need for sleep, and our structure of how our brain waves change throughout the night also changes and reduces as we sleep throughout life. So we do experience those changes. Naps maybe become more common, as we often see older people taking a daytime nap. And then we also have an increased risk of sleep disorders. So stuff like sleep apnea or sort of REM behavior disorders or restless leg syndrome can all start to impact how we sleep and how replenished we feel after our sleep.
It tends to feel a little bit doom and gloom, doesn't it? But I know you have loads of top tips. There are things that we can do to improve our sleep. So shall we head through to the bedroom and have a chat about that there?
Sounds good.
So here we are in this beautiful bedroom, and for people who don't have a sleep disorder but have disordered sleep, there are lots of things that we can do to improve our sleep. And I think sometimes people might hear these things and think they already know, but if we're really honest with ourselves, we do develop bad habits over time, and it is really important stuff. So what sort of tips do you have that we can all do to I guess, develop a better sleep routine and have a better chance at getting a good night's sleep?
Yeah, so there's quite a lot of steps that we can take towards improving our sleep. So the first one would be to create a routine. So we want to be making sure that, you know, we're trying to go to bed at the same time every night, and again, waking up at the same time every morning. And where that may seem like, how does that fit in with modern day life and society? It's about adapting what we do during our waking hours to accommodate that. And that just helps regulate our circadian rhythm, which is our internal clock for sleep.
Does that mean at the weekends you should still be getting up at the same time you do during the week?
Yes. So where I know a lot of us, myself included, are quite guilty of not doing that, it is important to try, especially if we're going through a phase of poor sleep and insomnia-like symptoms. We want to be making sure that we are being really regimented on our sleep routine.
Okay, we might not want to, but it might be the thing that helps.
Exactly.
And that's why we've got a little alarm clock here.
We do.
And I know that shouldn't really be next to the bed, should it? Where should it be?
So ideally, we would have it turned around away from the bed. So we don't want to be watching the clock or the time throughout sleep. So we want to be making sure that, you know, when we're sleeping, we're fully focused on the bed. That being said, we do all have to wake up in the morning, and you know, often if we need to go to work for earlier than we want to wake up, we definitely need an alarm. So making sure that we have the alarm where within the room where we have to get up and out of the bed, but not directly facing us, so it's going to stimulate us.
And the reason for an old-fashioned alarm clock is?
Yes, so we don't want any mobile devices in the room. So here you've got your mobile phone, there's a laptop.
Can I just put this down on the floor?
Ideally not, so this shouldn't have even entered the room.
Okay.
So the bed is not a place to do work emails.
Yeah.
It's not a place to watch any movies or Netflix or TV, nothing of the sort. So we want that out of the room.
Well, you sleep experts, I know, say that the bed should only be for sleep and sex and nothing else.
So
then the brain recognises that that's what it's for.
Yeah, so we want to stimulate a routine that is just for resting. So we don't want to be, you know, stimulated by crazy art or loads of different furnishings or, you know, lights coming through the room. So we want to make sure that our sleep environment is proactive for sleep.
So what about curtains then? Because there's a lot of light shining through these curtains that we have here.
Yes, so you just caught me as I was going to highlight that unfortunately, as lovely as these curtains may be, they're not actually that effective in terms of our sleep. So the amount of light coming through these, ideally we would have a blackout blind behind these, and that would just prevent light from infiltrating into the room during our sleep time. So that's one option. We can also put on an eye mask, which a lot of people helps their sleep, but it is best to try and create the room to be that sleep environment, so we don't need those accessories.
So it's like making the room like a cave, isn't it?
Exactly, yes.
Make it dark, ideally quiet and a bit bland.
Yes, and on top of that as well, we want to make sure that it's a nice temperature, so cool. So ideally about 18 degrees Celsius, if you can control the temperature, and making sure that we're not completely, covered in soft furnishings, which then increase our core body temperature.
So I need to get rid of this lovely cushion as well.
Ideally, pop that off the bed.
That's that
Another
done.
thing that we are reluctant to get rid of from our room is our lovely pets. So dogs, cats, rabbits, whatever fluffy friend it is that you have in the room should not be in the sleep environment.
Right, why is that?
Because they can distract our sleep. So they cycle through sleep on a different stage and time as us. So we want to make sure that there's minimal distractions within the room.
Okay,
so
should we get rid of that then?
Let's get rid of this.
Why don't you chuck that one?
So we get rid of this out of the room.
Bye-bye, doggy.
And we can keep them nice and safe in the kitchen.
Okay.
So yeah, after that, then we should have a nice environment to sleep within.
Okay, so we've got our routine, we've got our nice sleep environment. What about things we can do for the rest of the day, our lifestyles?
Yeah, so lifestyle factors do start to infiltrate sleep. So coffee in the morning only. So we shouldn't be having coffee after about 2 or 3 in the afternoon. Okay. And for those people who are struggling a lot with sleep, increasing coffee during the day in order to stay awake and function is actually not a good treatment plan, and eventually it's going to start to go out of control, both the sleep and the caffeine. So we want to make sure that you're being careful and considerate with your caffeine intake.
Okay, and alcohol as well, that's terrible for sleep, isn't it?
Yeah, so alcohol is terrible for sleep. A lot of people actually think having a few drinks might help them fall asleep, and that's not exactly true. So it may help you fall asleep, but it definitely won't help you stay asleep or get the sleep that you require. So it actually suppresses that dream sleep. So it's important to make sure that we're not drinking too close to bedtime, and also making sure that we're not over drinking.
Okay, anything else we can do in the day?
Yeah, so exercise as well is a great activity that we can do, preferably not right before bedtime, because we'll be almost high off the endorphins. So we want to make sure that we're doing it at least a few hours before bedtime. Eating healthy, so making sure that we're getting our 3 meals in, and then any snacks as well, and trying to avoid high sugar foods, especially towards bedtime.
Right, okay. And I've got some earphones here, so I guess the question is, if you've done all of that and you're still led here at night and you cannot sleep, what else can you do? I'm guessing it's use these.
Yes, it is. So unfortunately, it is something that we've all most likely experience at least once or twice in our life, and it's a really unpleasant experience. But there are things that we can do to try and take the focus off not being able to fall asleep or initiate sleep. So having something within the bedroom that you might find relaxing or mindful or encouraging meditation. So for some people that will be reading the book. So for me personally, I read my book before bed every night and it works perfectly well. For other people, that could be torturous, asking them to keep popping out a book in the middle of the night. We also don't want it to be a very topical, exciting read, because you'll just carry on reading. Exactly. With the headphones, they're a good option for anybody who finds it sort of bedtime stories or sleep podcasts. It can be really helpful to pop one of those on, making sure there's no digital sort of clocks nearby the bed. So popping on one that's already saved, earphones on, and helping yourself to sort of fall into that restful state.
Okay. And I know people will want to know how long should you stay in bed for, and obviously people shouldn't have clocks or have access to time, but how can they tell when might be the right time to get up?
So if it's starting to feel anywhere between sort of 15 to 20 minutes, definitely within the half an hour we should be getting up and heading outside the room. But obviously that's going to be how it'll feel, because we won't be looking at our clocks. So whatever feels like it's been that amount of time and you're really struggling, then that's a good guide to get up and leave the room.
Okay, so I guess if you're sort of feeling like this is just not happening, sleep is not happening.
It's not happening, leave the room
Get
and
out.
concentrate on something else for a bit and try again later.
Well, thank you for that. That's really, really interesting. And I think, like we said at the start, if we're really honest with ourselves, there are some things we might not really want to do in that, but they could make a big difference if we're struggling with our sleep. I think also to add that people who are having consistently poor night's sleep over a period of time should see their GP, because it could be that there's a sleep disorder going on.
Yes, definitely.
And if people have just had a baby, sorry, can't help you with that one, can we?
Hopefully the good will follow, but not initially.
Sleep is such a huge topic, and there's new science and data coming out all the time, and it's really fascinating. And that's why it's so important that we have sleep experts who study sleep so that they can help us have a better understanding as well. And to help us dig a little bit deeper today and get the latest on those sleep questions that we all want to know more about, I'm joined by sleep expert Professor Jason Ellis. Hi Jason, welcome.
Hi Zoe.
Hi. So I'm really excited for our conversation, because there are so many things that we can discover that are new about sleep, and you know about all of it because you're our sleep expert. So to give people a bit of context about your sleep credentials, you're a professor in psychology at Northumbria University and director of the Northumbria Centre for Sleep Research. So you definitely know your stuff. So for anyone who is struggling with sleep, hopefully we can answer some burning questions they might have. So let's start off then with, why is it that some of us struggle to sleep and some people don't?
It's a great first question, and I think that we need to think about the biggest impact on our sleep, which is aging, actually. As we get older, the parts of the body, the internal system that really regulates our sleep, which is the body clock, the circadian rhythm, and then there's the drive to sleep, which makes us more and more tired. Both of those start to degenerate slowly and over time, but they actually do degenerate, which makes us a lot more vulnerable to not being able to sleep well.
Okay. And when you say as we get older, what sort of age does that start to kick in?
Okay. It starts around the age of 25, believe it.
25?
Yeah.
I thought you were going to say maybe 65 or 75. Wow, okay.
It's very small increments, but we are seeing reductions in the amount of melatonin we produce, for example, the amount of deep, refreshing sleep that we get. Year on year, they decrease a little bit.
Okay, really interesting. How long can we cope with poor sleep before it starts to have a significant impact on us?
Well, I think we've all had the odd bad night. And the next day we're a little bit more moody, a little bit more irritable. Probably not going to use please and thank you as much. But actually, the system can correct itself, and it will correct itself. When we start talking about the long-term impact, it's poor sleep over months that we're talking about here.
Okay, and that's often down to the environment, isn't it, now, where we have mobile devices, we're working longer hours, and maybe the opportunity to sleep is not as good as well.
Well, we also got to think about culture. You know, we've got terms that permeate our culture. Snooze, you lose. I'll sleep when I'm dead. The value of sleep and its ability to correct itself actually is lost in that mix.
So if people say have sleep issues for a week or two and then it gets better, would that be all right, or what's the sort of timing?
Generally, if we're talking about stress-related sleep problems, 1 to 2 weeks, that's a normal adaptive response to the stress. You've got a lot more cortisol, a lot more adrenaline, and that's just keeping you awake longer, just so that you can try to cope, problem solve, work out solutions. Once we go over that 2-week mark, those hormones shouldn't really be impacting our sleep anymore.
Okay. Tell me a little bit more about the term sleep anxiety, which I've experienced myself actually a long time ago, where you persistently can't get to sleep, and then you start to get very anxious about not being able to get to sleep, and the problem sort of gets worse and worse.
The vicious cycle. It's interesting because there's a theory around this that we start out when we stop losing sleep because of stress, it's because of the stress. And it could be a positive stressor like a wedding or something nice, but it's still going to keep us awake. After about 2 weeks, we might see this switch point where the stressor stops you from sleeping and suddenly the sleep becomes the stressor itself.
Yes.
That's what we talk about in terms of sleep anxiety. And there's some really new research actually came out earlier this year, which demonstrates that is the single biggest factor, the sleep anxiety, which makes us go from just a few weeks of sleep disruption to having chronic insomnia.
Wow, fascinating. So it's actually then this worry about getting to sleep is the issue that's preventing the sleep.
It's self-perpetuating.
Yeah. I think there'll be lots of people listening to this who are thinking, that sounds familiar. How do we know when it changes from struggling to sleep, so disordered sleeping, to actually becoming a sleep disorder, such as insomnia?
Yeah, so when we generally define insomnia, we're sort of talking about 3 months in duration. That's the clinical definition. But actually, after those 2 weeks, something's not quite right, and we should be going in and intervening early.
Okay. That's interesting as well, because I think a lot of us don't, do we? We let things get worse and worse. A lot of people fall asleep fine, but they suffer sleep disturbance, waking up regularly through the night and struggling to get back to sleep. What's going on there, and what can they do?
So this is part of the entire sleep process. If we think about sleep, we sleep in 90 minutes cycles as adults. And during that time, we're going through stage 1. And that's the point at which we're having that transit between being awake and being asleep. That nodding dog behavior that we
when you're
might
on the
get.
train and neither in or out.
Exactly. And then you might experience something like you've stepped off the pavement too quickly.
Yes.
Yeah? It's called a hypnic jerk.
Right.
And what that is it's a way of trying to get rid of any excess energy that you've got, creating a nice, smooth transit into the official onset of sleep, which is stage 2.
So it's normal then, so that should happen?
Yeah.
Okay.
It's just, you may have experienced it. You have the jump,
Yeah.
but then you go,
It's a relief, isn't it? You have the jump, you're like, I actually haven't fallen, everything's okay. You take a sigh and then you go to sleep.
that's exactly the passage from being awake in stage 1
Okay.
to going into fully sleep in stage 2.
But I don't notice that I always do that. Is it that sometimes I'm not aware, or?
It may be sometimes you're not aware, you're very sleepy, or it might be that there's not a lot of cortisol left in the system to create the actual physical jump per se.
Okay, fascinating. So interesting. It's 90-minute cycles.
Yes. So we get vulnerable to waking up every 90 minutes. You finish a cycle before you start the next one. So those create vulnerability points. For most of us, we'll roll over and we'll go back to sleeping. But if something happens, we need to go for a wee. We might have a hot flash, our pain medication might be wearing off, or we might indeed have pain. That's enough of a window to create an actual awakening.
Okay.
Those are normal, they're natural. The issue becomes, can you get back off to sleep after you've dealt with it?
Right. So waking up in the night, especially if there's a reason, is okay. And that's why you shouldn't start looking at what time it is or stressing about being awake. You just need to deal with whatever you need to deal with and just get yourself back off to sleep.
That's exactly the thing that feeds into that sleep anxiety that we're talking about.
Yeah. Are some of us just naturally early risers and some of us actually true, genuine night owls? I kind of know the answer to this, but tell us.
Yes, we have something called chronotypes, and this is people's performance, whether they're really good performing in the morning or good at performing in the evening. There's a huge amount of people who actually sit in the middle that we call intermediate types, and they have a lot more flexibility. But what we see is if we take those people who are very morning oriented, our larks, and we put them into an evening situation, they don't handle it terribly well. Similarly, if we took somebody who's a real extreme owl and we made them do stuff in the morning, again, they're not going to perform as well.
But there are pros and cons to both, are there? So if you're the world is really set up for people who function well in the morning, isn't it? Because we tend to have to get up and either go to school or go to work quite early. But are there some I believe, and you can let me know if I'm wrong, that people like me who are night owls, we adapt better to shift work and we adapt better to jet lag?
Absolutely. So yes, the world is set up and it's all preordained around the morning, isn't it? It's work time, it's school time, it's getting things ready. And that's part of a culture that we have, whereas evening's a lot more flexible. You're absolutely right. There are some benefits around being able to adapt to changes in your body clock if you're more evening oriented. And so you have that extra flexibility that might help you work better in a shift work environment.
Yeah, well, that makes a lot of sense to me. So I wanted to ask next about the different stages of sleep. So you mentioned just then about the first stage of sleep, which is this transition state, which can end the jerk.
Yep.
So is that stage 1?
That's stage 1. The actual jerk is the transit into official sleep, which is stage 2. Stage 2 takes up about half of the whole night. We ignored it for many, many years, but recently we've started to understand that it's got two main functions for us. The first is it allows us to review the day to determine, what do I need to keep? We expose ourselves to a huge amount of information. Sights, smells, tastes. Do we need all that information? Probably not. So we're determining, what do I need, what do I not need, so that I can turn the things I do need into long-term memory later on.
Right.
The other part of stage 2 is what we call a sensory gating mechanism. It's a posh way of saying keeping you asleep.
Right. Okay.
So we just use the example of pain. People have pain, or maybe the neighbours, they've left the television on, or they might be having a row. It's in our interest to stay asleep. And so our brain will actually create masking so that it says, don't focus on that, focus on the sleep, stay asleep. It actually gates across those sorts of intrusions.
Okay. Wow.
Then we go from that into stages 3 and 4, or slow wave sleep. A lot of people will hear about it in terms of deep sleep. This is where we fix the body. The immune system, really, this is where it gets its main activation from. When you're not feeling very well, what do you want to do?
Sleep.
Exactly, because we want to get the immune system working. The endocrine system, and that's helping us with our fertility, it's helping us with our eating behavior, it's helping us regulate all of those things around insulin. That tends to be also functioning and really efficient during slow wave sleep. The lymphatic system, this is one that's quite recent. It's our understanding that during slow wave sleep, we actually clear out toxins in the brain. And those are the toxins that have been associated with things such as dementia.
Wow. Wow. So the brain, a bit like the lymphatic system of the body, is it then? The brain's actually cleansing away toxic proteins.
Yeah, pretty much putting a washing machine right the way through the system.
Gosh.
We go from stages 3 and 4, slow wave sleep, we actually go back up to stage 2.
Oh.
Check the environment. Is it safe to carry on sleeping? Yep. And then we're allowed to go into REM, rapid eye movement sleep. This is where we deal with the emotional and the memory side of things. This is where we regulate our emotions. And this is where we consolidate a lot of our memories. So when we've not had a good night, for example, this is one of the reasons we are a little bit more moody, a little bit more irritable, or we might even get a little bit more hyper.
Yeah.
Because-
Or anxious as well.
Or anxious. Because what's happening during REM is we're putting a cage around our emotions and dealing with them, trying to keep them to really a nice balance so we don't go in either direction.
Wow. So stage 3 then is kind of about the physical body, keeping us alive and healthy, and stage 4 is about sort of our psychology, sort of keeping us in a good nick from a mental health point of view, which I guess is why we see such close links to poor sleep, short sleep, with conditions like depression and anxiety, right?
Absolutely.
Because if we're not getting enough sleep at the end, then we're not able to do that sort of repairing and taking care of ourselves.
Absolutely. It's slightly more complex than that, though.
Always is, isn't it?
Of course it is. This is why I've got a job. When we're talking about REM, it's how quickly REM comes in as well.
Right.
REM should come in at around 90 minutes in that first sleep cycle,
Yeah.
because it's the end. If it comes in too early, it's a really good sign that we're likely to become depressed in a few weeks' time.
Wow. God, it's so interesting, Jason, honestly. Right, anyway, we've got to move on to the next question. What about napping? Is napping good for us? And if so, why?
The first thing I would always ask about napping is, why do you need to nap?
Right.
If you need to nap, that's generally an indication that there's something wrong with the quality, the quantity, or the timing of the sleep that you're getting.
Right. Yeah.
Now, there are occasions where people will need to nap. New mums,
Yeah.
chronically ill people, of course they need to nap. But for the majority of us, why are we napping? Is it that we're sacrificing sleep somewhere along the way?
So staying up late at night working or having to get up too early.
And I mean, napping can be beneficial. And certainly in the context of learning, for example, we might want to ask people to have a nap after they've learned some information, because it will help them consolidate it, turn it into long-term memory. But we've got to keep it short.
Yes. How long can we nap for before it becomes more detrimental?
We talk about 10 to 20 minutes because after that, what tends to happen is we start a full cycle.
Right.
And if you think about it, the full cycle's 90 minutes.
Yeah.
If you wake up after 45 minutes, you're going to have 45 minutes where there's going to be a little tension. Your body wants to finish the sleep cycle, and you've got to attend to something in the environment. It's what we call sleep inertia. You know that groggy, awful feeling we
Yeah,
get?
feeling worse for it.
Yeah.
Okay, that makes sense. What about dreams and nightmares? Are they a sign of good or bad sleep? And is remembering them significant?
Well, it's interesting. We've started to understand a little bit more about dreams, but it's still an area that we don't know an awful lot about. What we do know is that if you remember a dream, you've woken up. So that's the first indication that it might not be the smoothest transition from being asleep to being awake. You should be finishing a sleep cycle perfectly relaxed without being in a particular stage, which should be in that zone.
Right.
So if you're remembering dreams, it means that you've woken up during REM.
Right.
We know that we have REM dreams throughout the night, but we can actually dream outside of REM itself.
Oh.
If we're dreaming in black and white and it's a lot more concrete, tied to the world, then it's a non-REM dream.
Okay.
The real fantastical, colourful, beautiful dreams that we have, or horrible nightmares, they're more REM-based.
Okay, so if you have a lie-in in the morning, which I know we're not really meant to do, but if you do, that's when you have those more concrete dreams.
That's right.
That's when you probably shouldn't be in bed anymore, is it?
Absolutely.
Okay. And you start sweating often as
Yeah.
well. Yeah. All making sense. All right. Final question. Is there any evidence behind white noise or brown noise being good for sleep?
There's a lot of anecdotal evidence. Let's describe what white noise is.
Yeah.
Have you ever turned the television on and it's got the in the background?
Yes. Well, not anymore, but back in the olden days.
Back in the old days.
Teletext.
Or if you really wanted to go and listen to your fridge,
Right, okay.
that low humming noise, that's white noise.
Right, okay, yeah.
And then we get lots of different variations which call different colours. So brown noise, we might think about taking our fridge to the river with us.
Okay.
And so it's got a little bit more depth in it. And then we've got pink noise, which actually is more rhythmic.
Right.
And that's why it's very often used in the context of babies, simulating the womb.
Right.
Is there evidence? There is some evidence, largely anecdotal, but there are a couple of studies which have shown that it's quite beneficial to use white noise in the context of not being able to sleep, masking out other noises from the environment. The partner who snores, for example, some people do use white noise effectively.
Okay, all those neighbours next door that you were talking about with the loud TV.
Absolutely.
It sort of drowns out other... Okay, Jason, so interesting. Thank you so much. I could literally sit here and chat to you about this all day. We've covered a lot of ground there, though, so I think let's go and join Amy again now and we can answer some of your questions. So in our final part of today's show, I'm back with Amy and Jason to answer some of your questions that have been submitted before today's event. So the first question is one for you, Amy. Since I hit menopause, my sleep has really deteriorated. What's the best solution?
So it really depends on what the problem is, so what's causing it. So as we experience the menopause, we might have a change in weight, we might increase our snoring threshold, and as a result of this we might actually be experiencing sleep apnea, which can cause excessive daytime sleepiness or tiredness or just overall dissatisfaction with our sleep quality. We also experience changes to our mental state, so anxiety, depression, and also a change in our sleep hormone, which may actually be increasing our insomnia. And also another point to mention is actually our changes in temperature, so spikes in our temperature, which we refer to as hot flushes, and whether or not they're sort of causing sleep arousals as well as it could be a contributor.
So I think that there are so many various different things going on throughout menopause. It's really trying to find out what they are and finding the solutions rather than there being one solution. Thank you. Will sleeping tablets, melatonin or sleep remedies help me, and are there any dangers?
So we prefer natural remedies. So natural remedies and lifestyle factors tend to have a hugely positive impact on sleep when used correctly and when used as a combined sort of approach. Medications are available and often have to be prescribed through our GP, and they're often given on a short-term sort of dosage. And the reason for this is because they can become quite reliable. So we end up almost believing we need these medications to encourage sleep. Whereas having them on a short-term period allows us to have that sort of almost placebo effect, which can often actually reverse insomnia or insomnia-like symptoms. So it depends, and it's again, person by person approach.
And what are some of the more natural remedies that you say you can use alongside lifestyle?
So things as simple as, you know, chamomile tea before bed can make a huge change. Melatonin also. So melatonin is a sleep hormone that's produced within our body. But again, that should be used correctly and safely. And so asking a professional for help in how to balance that within the life can really be of proper importance.
Okay, all right then. Jason, how effective / accurate are sleep trackers on my phone?
Well, if you're a normal sleeper and you don't get anxious about your sleep, they can be used quite effectively. They're quite accurate, actually, in terms of sleep duration. So how long you're actually getting per night. The challenge comes when we start to look at sleep disorders. They're not terribly accurate for people with sleep disorders, but also, you know, a lot of them telling us information about what stages of sleep. Well, I can tell you that that is not terribly accurate. Right. We tend to have to use an awful lot of electrodes in our laboratories to work it out. So we're not really going to get it from our watches.
Okay, so it can give you a reasonably accurate length of time you're asleep, but not perhaps much more than that.
Not really.
Okay. Does lack of sleep put me at higher risk of dementia?
Great question. There is an association between short sleep durations for a long period of time and disrupted sleep and dementia. We think this is because during slow wave sleep, that deep sleep that we get, we're clearing out the brain and we're clearing out particular toxins, beta amyloid, which is largely associated with dementia. Now that's great in the sense that it gives us an opportunity as well, because if we can start to manage sleep, are we going to start to manage people getting dementia, or at least the pathway?
And I think, you know, many people are very scared of getting dementia. So I think, you know, this information, it's not there to scare us. Actually, it should empower us to think we can all make tweaks at least to improve the quality of our sleep. And I think that's quite a motivating factor potentially for people.
Absolutely.
Amy, are there some sleeping positions that are better than others?
Simply put, no. So it's quite a common question. How can I improve my sleep? If I sleep on my side, if I sleep on my back, it comes down to each individual. So obviously if we experience back pain or shoulder pain, we might find a position comfortable and another position not comfortable. The only time that it sort of really comes into importance is when we have supine dependent disorders. So particularly our sleep apnea, where lying on the back actually increases the number of events that we're having. So how many times we're having those stoppages of breathing. In those cases, we would try and train the body to sleep in a non-supine position.
So that's not on the back?
Not on the back,
side,
but again,
it
can be on the front. It really comes down to preference, and there's throughout life, our sleep position may change as our body changes also. So yeah, so not necessarily a perfect position for sleep.
And I once heard a tip, I think it was from you, Jason, many years ago, that you can strap a tennis ball onto the centre of your back so that if you roll over onto your back during sleep, you'll automatically shift back onto your side or your front.
Yep.
Does that work?
It does. Thankfully, due to technology improvements, we actually have what is now just a band that sits around the waist.
Designed for that. I mean, it
so
was years
it's
ago.
much less intrusive and uncomfortable, but yes, it would be a really good...
I'm old school.
It would be a very good way of preventing that supine sleep for sure.
Okay. Jason, this is one for you, and you can tell us why. Why do my legs twitch in my sleep?
So what tends to happen is that some people have got a problem whereby they actually have slight twitching in their legs at night, and it's called periodic limb movement disorder. And I happen to be one of those people who suffers from it. Now, I don't actually remember these events, and many people who have them don't remember them, but it does lead you to feel a lot more fatigued and tired during the day because you've had slight awakenings during the night. We tend to separate this out from something called restless leg syndrome, which is more as you're getting ready for bed. Itchy, crawly, uncomfortable sensations in the legs which prevent you from getting off to sleep at night. But they are quite joined. Now, there are things we can do. We can go and see our GP, talk to the GP about medication or other options.
Okay, all right. And what's interesting, I think, and a reminder for everybody, is that you can be a professor of sleep and actually we're still affected by these things, aren't we? As humans, we can still be affected.
You can still also go unnoticed despite
Right,
your plethora of sleep knowledge. These things can go without being caught until sort of, our symptoms take over and suggest that there is actually a sleep disorder there.
Yeah, and I guess, and yours was only picked up because you volunteered to test out some new equipment. You were the guinea pig.
Exactly. I decided to try out the new equipment myself, and then my technician comes and says, "Oh, look at this," and I think, well, that's terrible. And then she tells me it's me, so it's okay. Got to do something about it.
The next question, for people who work shifts, I have a lot of experience of that, what can they do to minimise any issues relating to poor sleep?
Of course, shift work is not great for us, and the things that we can do to help minimise it focus really about our relationship with light, dark, and valuing the time that we sleep. Before the end of a night shift, it's best to try to cool down with light, not get too much access to light. You'll start to wind the body down getting ready. When you do get home, don't fall asleep on the sofa, go to bed. The sofa is a daytime zone. You're going to have people outside, you're going to have noises, the washing machine might be going, and let people know that you are actually on a night shift. Equally, if you're getting ready for a night shift, getting access to light before the night shift is going to give you that extra alertness to get through.
All right, really great tips there. And finally, a very, very, very common problem I hear about is how can I stop snoring? Or actually, often it's how can I get my partner to stop snoring? I think if we had the answer to that, it would be very rich.
Yeah, it's an interesting one. Snoring, there are a couple of things that make snoring worse. So if you've had alcohol, for example, or we use some sleep medications, they tend to relax the throat and therefore it's more liable to closing ever so slightly. If there is snoring, it's not to be taken as a trivial thing. I know in society we tend to do so, but actually it's important to go and check to see whether it is something more severe, obstructive sleep apnea, which would need treatment. And there are plenty of treatments available.
It's often the person who's not snoring that is the one whose health can suffer, isn't it? Because there's always then having different beds as well, having
the sleep divorce,
to prevent a real divorce.
Yeah, it can make a huge difference, and it can increase, lots of other things within life which then enhance the relationship. So it's not to be feared.
Yeah. Okay. Well, Amy, Jason, thank you so much for that. And I really hope that there were some takeaways there that will help you. I think the bottom line being we can all make some changes to improve our sleep. So feel empowered, not afraid.